Your doctor has recommended that you undergo surgery to remove a bunion. But what does that actually mean? A bunion is caused when the metatarsal bone in the big toe gradually shifts towards the second toe. This shift causes a bump at the inside of the big toe's first joint. As a bunion grows, it can lead to other painful foot problems, including hammertoes, calluses on the bottom of the foot, and arch pain. Bunions are largely hereditary, but they can affect anyone. Even a small instability in the bones of the big toe can trigger the growth of a bunion. A bunion does not generally lead to other health problems, but left untreated, it can eventually limit the ability to walk. Luckily, bunions can be treated with a fairly simple surgical procedure. In the case of bunion repair, there are no real alternatives to surgery. You may choose to live with the discomfort of the bunion, but there is a chance the bunion will continue to worsen, causing further pain and even limiting your ability to walk. Of course, no surgery is completely risk-free, but your physician believes that if you decide not to undergo the recommended procedure, you will have to endure considerable discomfort. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. In the operating room, the anesthesiologist will begin to administer anesthesia, most likely locally, causing your foot to become numb. The surgeon will then apply antiseptic solution to the skin and place a sterile drape around the operative site. The surgical team will then make an incision over the bunion, and the skin will be pulled back. Below the skin is a membrane or capsule surrounding the MTP joint that connects the metatarsal bone to the rest of the big toe. Another incision is made, opening the capsule and exposing the bone. Your doctor will then cut or file away the bony and fibrous outgrowth of the joint. After the bunion has been reduced, the surgical team will close the MTP joint capsule with stitches. And the outer layer of the skin will be sutured closed as well. Finally, a sterile dressing is applied. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. While you're in the hospital, your medical team will continue to monitor your body's immediate reaction to the procedure just performed. That means that your time in the hospital is not really for rest and recovery, and you should expect to have your movements restricted, and even your sleep interrupted by nurses and other medical staff. The amount of time you spend in the hospital will depend on your age, your health, and whether or not any complications arise. Be assured that once your doctor feels that your condition is properly stabilized, you'll be allowed to leave. Be sure to follow your doctor's advice and allow the full recommended time before you return to your normal routine. Bunion surgery only rarely leads to complications. One is a persistent residual neuralgia, or pain around the scar. It can be either localized or general. It may develop soon after surgery, or even weeks or months later. Other complications include excessive bleeding, slow healing, or a recurrence of the bunion.